get right to it. Kelli Jo Greiner, Medicare Product Manager with the state of Minnesota, is on the line to answer your questions. And thanks for being with us again. Appreciate it.
Thank you for the invitation. Glad to be here.
Okay, so we're in it right now. That timeline started October 15th for open enrollment for Medicare, the first day that people could start to make changes. I want to also just reiterate the deadline, which is confusing, but you've been talking about December 7th as a really important date. Do you want to just mention?
Yes.
Okay, go ahead.
December 7th is the last day of open enrollment for most people. Some individuals, like the UCare folks, are going to get additional time, but the vast majority of people have until December 7th. And then their plan that they enroll in prior to or on that date takes effect January 1st, 2026.
Okay. Yep. Really, really important to remember that. I know there's so much here. Let's just get right to some questions that we have. This is one from CG. So our friends received a cancellation of their UCare policy that they've had for several years. What is the reason that UCare was allowed to cancel everyone? Wasn't this plan subsidized by the state of Minnesota? How did this happen?
Very good question. For financial reasons, UCare got out of the Medicare Advantage business, and they are reimbursed by Medicare for providing these products. And a lot of the Medicare Advantage organizations state that they have not been reimbursed adequately by Medicare. So that's why this year we are seeing quite a few plans withdrawing from the market. That is the primary reason they are giving. The plans that provide the medical assistance benefit and Medicare benefit, those are combined products, those do get some additional funding from the state of Minnesota, but it was not sufficient funding for them to continue to offer those products to all people. But they will be available, those, we call them dual eligible products for people on medical assistance, otherwise known as Medicaid and Medicare. Those will still be available for some people, but the vast majority of UCare recipients are going to have to change plans before December 7th. Okay. Is when we're encouraging them to change by that date, so it takes effect January 1st.
And this is interesting that our follow-up question here is from Diane, who is asking this clarification. So a broker told me I have until December, first of all, I'm on UCare Advantage, which will end on December 31st. A broker told me I have until December 31st to sign up for another Advantage plan. Because I'm on UCare, the deadline for all others is December 7th. From a different source, I heard the deadline is December 7th for everyone. My broker could not schedule me until December 19th because I have until the end of the year. She's just kind of trying to, get the dates straight here.
And I had stated that UCare does have a longer period, but here's the issue. They can actually enroll in another Medicare Advantage plan or purchase a Medigap policy without any underwriting, which is health screening. If they want that plan or policy to take effect on January 1st, particularly the Medicare Advantage plan, we are encouraging them to not wait until December 31st. Even though that plan will take effect, it will not be in the system in time. So if they go to the doctor, say the first week of January, it isn't going to show in the system yet. And when Medicare Advantage and Medicare Part D first began, it went right up to December 31st that people could enroll, and then it was supposed to take effect January 1st. There were so many problems with the plans not taking effect on January 1st that Congress changed the date to December 7th. But you're right, people do have additional time with the UCare benefit. They do. But again, we're not encouraging them to wait right up until December 31st.
And then how about the back end deadlines? Can we just go through those as long as we're talking about it? So you get into January, you get into February, you get something in the mail and you go, wait a second, now why are my prescriptions not being covered? So what are the timelines for people on who have had UCare? And is it different than for everybody else? Or what's the timelines for January, February, March?
Okay. Let me talk first about the UCare recipients.
Okay.
They actually have until February 28th of 2026 to buy a Medigap policy without any health screening. Now, keep in mind, their UCare policy is going to end at midnight, December 31st. So if they wait and don't buy a Medigap policy until, say, the middle of February, that is going to mean for that whole month of January and that half a month in February, they will just have original Medicare, because they won't be in a Medicare Advantage plan. They'll have original Medicare Part A and B. They will not have any prescription drug coverage unless they enroll in a separate drug plan. So that, again, is why we're really encouraging people to take action and do something before the end of the year. Then the other thing are people that are not on UCare. They have till December 7th to change to a Medicare Advantage plan or to return to original Medicare and get a Part D standalone plan. They do not have guaranteed issue rights to purchase a Medigap policy. And a Medigap policy is a policy sold by private insurance companies to fill in the gaps of original Medicare. Most people only get a one-time opportunity in their life to purchase a Medigap policy without any underwriting or health screening. And what that means is the company can deny and refuse to insure you based on your health condition. And that's a very common occurrence, just so people are aware of that. So those folks don't have that ability to purchase a Medigap without the health screening. What they do have, and this is even getting more confusing, if they enroll in a Medicare Advantage plan by December 7th, that takes effect January 1st, they have what's called a Medicare Advantage open enrollment period. They have from January 1st to March 31st to change to a different Medicare Advantage plan. But the sticking point with this is they have to start the year, the new year, enrolled in a Medicare Advantage plan.
Ooh.
I know.
Oof,
lots of
okay.
dates
That's
to
a
know.
big one. Yeah, and yeah, hopefully people can go back and watch this and stop and pause it. I know I'm going to have to, and go back and listen to everything over and over again. This is so, it's just so much. Can we talk about, so as right now, if you're still in the place where you're trying to figure this out and understand what you may need or what you don't need going into the new year, when you're talking with either the what used to be the senior linkage line, which is now the Minnesota Aging Pathways hotline, or you're calling, going on Medicare.gov, or you're calling the Medicare, what is it, the Medicare, say that one more time.
1-800-Medicare hotline.
Thank you. 1-800-Medicare hotline. What types of what kind of information should you be giving to the people on the other end of the phone so that they can help you best decide what you need going into, if you were just to bullet point, a few things for people to make it easy?
Great question. The first thing you need is your Medicare card. Have that handy. Okay. Then if you have other insurance, have that card handy. Like if you have UCare, have your UCare card handy. And then your list of prescription medications. Okay. Because all of that information you will put in, or the person helping you will put into the Medicare Plan Finder to get the results that are basically unique to you and your situation.
Would you recommend, Kelli Jo, people just do this every year just because? I mean, this year obviously.
Gosh, yes, yeah, definitely.
Okay.
The Kaiser Health Foundation does studies every year, and every year they do a study on the people on Medicare Advantage plans and Part D plans that reviewed their options and looked at what they wanted for the following year. And the vast majority of people do not review their options and do not make a change. And this year, because it is so critical, it is not just the UCare folks that are having to change plans. There are many other plans that have pulled out of counties and zip code areas where people have to enroll in a new plan for 2026. So this is not the year to just sit back and not do anything, because in that situation, what happens is you start the new year with just original Medicare A and B, no coverage for your deductibles or your co-pays or your coinsurance, and you won't have prescription drug coverage.
Yeah, this is so important. We're so worried about people who are going to run into issues in the new year, and you don't think this affects you if you're in your 20s and whatever. This will somehow affect you later in life. You're going to have to deal with something like this at some point. If you can reach out to your family members or your friends who are, maybe confused about this, you could be Kelli Jo and still things could stump you once in a while. I mean, this is just one of the most confusing things I've ever covered, ever. Let's see, just looking through a couple more questions here. I'm 66, plan to work until the end of 2026 and will be 67. Can I wait to enroll until the end of 2026?
Yes, you can.
Okay, great. Easy, easy. There you go. There you go, Randy. Gotcha. Not our Randy, different Randy. Let's see, a couple of more here. And I think also important to point out, Kelli Jo, we're talking a lot about UCare, which is warranted because UCare is getting rid of all of its Medicare Advantage plans. But also, those of you who don't have UCare, don't think that you don't need to pay attention, right? Do you want to talk through some of the other providers that we know of? And I know we don't have specifics, but just addressing that other people will be affected as well.
The first thing is that premiums are going up overall about 18%. That is a larger increase than what is happening in the vast majority of states. So that's an important thing for people to know. The second thing is we are seeing provider changes. For example, Mayo Clinic is not going to participate with the vast majority of Medicare Advantage plans in 2026. So this is creating a lot of issues for people with them having to look at other options. And as it stands right now, it appears Medica and Blue Cross Blue Shield are the only two options that Mayo will participate with in 2026. And part of the challenge we run into every year is that providers can change throughout the year. A provider can make the decision they're not going to participate with the Medicare Advantage plan at any time during the year, not just during open enrollment. So there's that constant issue of, will my provider remain in my plan throughout the year? And hopefully they will, but they may not.
Okay. Kelli Jo, thank you for your time again. We're going to do this every Monday, dedicating some time to, and maybe even more frequently as we approach that December 7th deadline as well. So thank you again for answering these questions. And as always, the state line is free. You can call that as well. It used to be the senior linkage line, now the Minnesota Aging Pathways line that you kind of work with. And I know it's been so busy. Thanks for all of your help and everybody on your end who's doing their best to get everybody squared away. Thanks.
I just want to give that number. It's 1-800-333-2433. But as you alluded to, we are extremely busy right now. So if you don't want to wait on the line, wait in a hold pattern, we encourage you to call 1-800-Medicare. Yeah. They have staff all over the country and they are experts in this, and they can provide the same kind of help that we provide to people in Minnesota. So okay. Thank you very much for this opportunity.
We'll keep talking. Thanks, Kelli Jo. Have a great day. We'll see you soon. Okay.
Bye. You too.
Thanks.
Bye.